From our 22 News Broadcast Center, this is 22 News in Focus.
Good afternoon and welcome to 22 News in Focus. I'm Nick Oresco. A 2022 report found that there is a growing mental health crisis among children and teens in the United States. The Massachusetts Society for the Prevention of Cruelty to Children says it's estimated that between 9 and 14% of children ages birth to 5 years old experience emotional or behavioral disturbance. Research indicates that serious symptoms of mental health issues can begin to be seen in infants and toddlers. This week on 22 News in Focus, we'll be talking about child and youth development, mental and behavioral health in our region, and support services and their programs. Mira Vista Behavioral Health Center provides both inpatient and outpatient psychiatric and substance use recovery services. They opened in April 2021 in the former Providence Behavioral Hospital in Holyoke. Here now to discuss the care options for teens and youth is Kim Lee, Chief of Creative Strategy and Development for Mira Vista Behavioral Health Center. Kim, as always, thank you for being here with us.
Thank you for having me. Appreciate it.
So, has Mira Vista, we'll get right into it, has Mira Vista seen an increase in demand for mental health services for adolescents?
Yes, I say yes, we have. We have seen an increase, and not just from our local area, as Mira Vista Behavioral Health Center actually responds to the need for inpatient psychiatric treatment from providers and parents from across the Commonwealth. So we're not just seeing individuals in need here, but really seeing it throughout the Commonwealth. And now that school is back in session, many of those stressors or triggers for anxiety and mental health situations and circumstances that may not be present during the summer months tend to be more prevalent when school is back in session.
At what age do you guys accept or start accepting youth for treatment?
Mira Vista, our adolescent unit, which is a 16-bed unit, we start treating children, if you will, from the age of 13 through the age of 17. However, if they're still in high school when they turn 18, they'll be treated on the adolescent unit. So 13 to 17, 18 if they're still attending high school.
How often do you see 18-plus-year-olds in the program?
We do. We see individuals, young people who are 18 but they're still in high school on the unit. We are seeing 13, 14, 15. The teens, adolescent years can be critical for young people, and so it's often a time of life where there's other physical challenges that they may be experiencing, and then coupled with mental health makes it a prime young age, if you will, to seek treatment at Mira Vista.
What are some of the reasons that a teen might be admitted for inpatient treatment?
We see individuals with many different diagnoses. It may be extreme anxiety, it may be suicidal ideation, extreme depression, it could be bipolar. So there are a myriad of reasons why individuals will access Mira Vista for inpatient psychiatric treatment, but it has risen to the level where outpatient counseling or therapy is no longer being effective.
So what does that process look like to get a child into treatment? What does a parent or guardian need to do in order to make this happen?
Well, just recently, actually, Mira Vista launched what we are calling our direct admission process. So in the past, the only way in order for an individual, whether it would be an adult or a young person, to access inpatient treatment would be through the emergency department. Now, through the Executive Office of Health and Human Services Behavioral Health Roadmap, which was launched several years ago, there is the opportunity now for individuals to access Mira Vista through a direct admit process. And what that means is somebody may contact Mira Vista, indicate that they themselves are challenged or struggling with their mental health, a loved one, a family member, their child, and we work directly with the crisis CBHCs or the community behavioral health centers that are in our area. That may be through the Center for Human Development, Behavioral Health Network, Clinical and Support Options. But we work with their crisis team in order to have an evaluation done. Once that evaluation is done and it's deemed appropriate, that inpatient level of care is the right course of treatment for this young person, parents will either drive them in, loved ones will drive them in, or they'll actually come in through the CBHCs that are community-based.
That's some big news. How significant is that recent change?
It's huge in terms of removing barriers and making the experience much more seamless and less stressful, especially for adolescents, especially for young people who are already experiencing a high degree of anxiety, for them to be able to avoid, if possible and when possible, an emergency room experience. It's big, it's important news.
I want to talk about some of the treatments and therapies that you offer. What are some of those types, and how beneficial are they?
So on our adolescent unit, our clinical team is comprised of psychiatrists, doctors, medical doctors, as well as nurses and mental health technicians. And so the young people who are on our adolescent unit are very busy. They're very involved in group therapies. They're very involved in individual therapy, talk therapy. It does become a community up on the adolescent unit. So when young people wake in the morning, they are asked collectively, what would you like to do this evening? What movies would you like to watch? 1 to 3 every day on the unit is reserved for education. We actually have a teacher who is on the unit, so we help young people to ensure that they're not falling behind in their academics while they're with us.
And I would imagine that it depends on the certain person as to how long they are in treatment for.
Absolutely. So the average length of stay at Mira Vista can be 7 to 10 days, but it really is all based on medical necessity. Some people are with us for less, and some young people are with us for longer.
So after those, depending several days, what are the next steps to help a teen transition back into everyday life after being in treatment?
So the minute any individual is admitted into Mira Vista, again, whether that be an adult or an adolescent, the process of transitioning them back to the community or back to their lives begins. So our social workers and our discharge planners are already working with patients or patients' families to ensure that the treatment they need to sustain the recovery that they've experienced at Mira Vista continues after they're discharged. So making sure that they have access to a pediatrician, they have their medications, that they have an appointment in the community with a mental health provider.
And I can imagine that can be difficult for a person to not be in treatment and then go into treatment for several days, again, depending on the situation, and then coming out and not necessarily starting over, but, you know, relearning how to live in a society.
We have some of the best, most talented, most experienced, and most educated group therapists in Mira Vista. And these professionals really are so dedicated and so compassionate and so passionate about this work that they do spend a lot of time with the young people on the unit, talking to them about their resiliency, talking to them about their emotions, talking about emotional regulation, talking about what will happen when they leave Mira Vista and what that next chapter of their young life will look like.
I'm sure it's not the first step or first thought in a parent or guardian's mind to do something like this, put their child into treatment. What advice would you give a parent who may be struggling to figure out what they should do with their child if they are struggling?
One of the first steps I would recommend would be, and I am not a clinician, however, being in this industry for as long as I have, and a parent myself, the first would be for them to talk with their pediatrician, to have a conversation with the medical provider in their child's life to explain how are they acting emotionally, how are they feeling physically, and to mention to them, have there been other changes in their lifestyle? Have there been changes in eating, changes in sleeping? Do they seem more isolated? Are they less willing to be connected with peers and friends? So those are the conversations that they should absolutely have as a first step with their pediatrician.
Kind of like a checklist to go over some steps in order to figure out what to do, right?
It is because every child is different, but having a conversation with a medical provider, there's also now, there are resources available. There is the 988 suicide helpline. There is the Massachusetts Behavioral Health Helpline. There's 413 CARES. So there are online resources or phone access that's available for individuals, parents, trusted adult caregivers to call and to contact in order to learn more about the resources that are available, not just at Mira Vista, but in our community at large.
And here is some additional information about Mira Vista services and programs. You can call 413-701-2600 or go to their website at miravistabhc.care. All right, Kim, as always, thank you for the information.
Thank you.
We'll appreciate it.
Take care.
After the break, we'll be talking about what's offered at the Bay State Center for Young Children and their families. You're watching 22 News in Focus. We're back now with 22 News in Focus. The Bay State Center for Young Children and Families at Bay State Health offers services and programs to children, families impacted by child abuse, domestic violence, and/or homicide. Their programs involve a whole family and culturally sensitive approach. Joining me now is Dr. Amanda Lowell, Clinical Supervisor, and Paradise Williams, Senior Caseworker from the Bay State Center for Young Children and Families. Thank you both for being with us today.
Thank you for having us.
All right, so Amanda, I want to start with you. When was the Center for Young Children and Families created, and what kind of work do you do?
Sure. So the Center for Young Children and Families is a relatively new program. We've only been around for about a year in our fully staffed way, and we were created in order to meet the emotional and behavioral and social emotional health needs of young children who are ages 0 to 5, as well as their caregivers.
Paradise, about how many families and children take part in your programs every year?
Well, like Amanda mentioned, we are a fairly new program.
Okay.
So within our first 9 active months, we were able to serve around 600 families, and that number is increasing by the day. So in our most active and most recent year, we don't have our final numbers yet because they're still going, but they are on the rise, and we anticipate that number to grow even more.
Are children referred to you, or can someone just call to schedule an appointment?
Both happen. Families are welcome and encouraged to call and schedule their own appointments. They're not required to have an outside referral. However, sometimes agencies, healthcare providers, educational institutions, they all send and submit referrals, and that works just fine too.
Amanda, why is early identification and support so important?
Early identification and support is critical, and there's a reason that I do the work that I do, because I think it has the biggest impact and has the potential to really act as prevention, right? And so the earlier we can identify that a child is struggling, or even the earlier in a family's life that we can identify that there are some challenges, the more likely we are to set up a family on a trajectory for success.
What are some of the first steps if you get a child in? What kind of process does that look like?
Sure, that's a really good question, because I think it can be really intimidating to think about bringing a really young child in for support around their mental health, their social emotional development. And so coming in, I think we try really hard to make families feel really comfortable, and having folks meet with a clinician who's trained in infant and early childhood mental health. And then we work really hard to get a really good sense holistically of the family. And that includes making sure we understand what's going on in a family, what are their strengths, what are their areas where they might need some support. And then we work hard to kind of get a full picture by speaking with other important people in the family's life, including people like pediatricians, preschool providers, for example, and then seeing if there are any other sorts of kind of measures or questionnaires that help inform how we might support a family.
I'll open this next question for the both of you. Anyone can answer. What are some misconceptions about mental health in early childhood?
I'll let you go first.
Some misconceptions are that young children can't be traumatized because they won't remember it. That is not the case. Children have memories even if they don't manifest in the way that you would think they comprehend them, and it can impact their behavior, the way they play, the way they learn, the way they grow, and it can be subtle at sometimes, but it does impact them.
Amanda?
She took the words right out of my mouth. Yeah, that young children can really remember things, and they can be really resilient too, and need support and benefit from support.
Right. I mean, going into a situation like this, it's scary, right? So, I mean, to have them feel comfortable enough to go through this process is obviously very important. How can caregivers recognize signs of trauma or stress in young children, their children?
Sure. I mean, that's a really good question because young children very often don't have language to be able to tell us what's going on, what they're thinking, what they're feeling. And the other part is that we're not mind readers, right? And so being able to pay really close attention to their behavior is critical, and try our best to make sense of their behavior. So sometimes we'll see kids who are really disruptive or even aggressive, and that's not always because of what they've seen, but sometimes it's a way that they're managing their big feelings and don't have another way to communicate about them. So paying attention to behavior and trying to make sense of it, slowing down to think about it is really important.
Unfortunately, we can't read minds. It'd be great if we could.
Right.
Make your job a lot easier.
Absolutely.
When someone does go in to the care center, what are the first steps in assessing a child?
That's a great question too. Paradise, and I'm happy to have you join in here as well, but I think really first step is speaking with our intake coordinator, who does a really excellent job of making sure that a family is a really good fit for what we have to offer. And then having an appointment with one of our well-trained clinicians who offers infant and early childhood mental health support, and then developing a really thoughtful, comprehensive conceptualization of what really a child is managing, and what treatment is going to be best for them, and then providing treatment. So we have evidence-based treatments that we know are effective to work with really young children, and then Paradise does a really excellent job of being a liaison for families as well and connecting them to other community resources.
Would you like to add on to that?
Amanda pretty much nailed it. That's exactly how it goes.
In that assessment process, is it a team process or individual?
That's a great question.
It is.
And so right now we have our clinical social workers who work directly with families, and then we have a team that includes myself. I'm a clinical psychologist and I supervise all of the cases. We also have a psychiatrist who's our medical director and helps support the work that we do. And then we have Paradise, our family partner, senior caseworker, and we also have students, including psychiatry residents, psychology students, and all of those trainees.
A lot of people.
It's a lot of people.
How can communities better support families in addressing mental health challenges?
I think that the most important thing that a community can do is reduce the stigma around the way that we speak about mental health, and reduce the stigma about the way that we think about parents who have young children who are maybe struggling, or parents who are struggling. So the better that we can normalize and be okay with conversations that are sensitive about mental health needs, the better, because then families will be more open to support.
And I think the good news is, as the years go on, mental health is becoming more talked about. It's widely recommended for many people, and it's become a very important topic, right? How have you seen mental health advocacy change in the recent years?
I mean, right now, especially in the digital age, we're seeing a lot more of mental health awareness posts on social media. The high schools and even young children preschools are having emotional conversations with their young students, whether that's a cozy corner where kids can point out their emotions on a chart, or if they need to take time for themselves. We're seeing a lot of caregivers practice things in their parenting that they may not have been exposed to during their childhood, that are allowing their children to express themselves in artistic ways, verbal ways, physical ways, and whatever needs need to be met in that way. We're also seeing more conversations like this one, where we're spreading awareness about not only mental health, but mental health for specific populations, whether that's men's, or in this case, young children, birth to 5, which is a very under talked about demographic. So I'm glad we're here having this conversation.
Yeah, and you mentioned social media. Obviously, there are positive aspects to it, but social media can also have those negative effects as well for young children, especially. We do have some information about the program on your screen right now. And a phone number as well, 413-794-0000. You can also head to their website, baystatehealth.org, for more information about the programs and services there. Thank you both, Amanda and Paradise, for being on the program.
Thank you for having us.
Thank you for having us.
All right, when we come back, we'll learn about a new youth-focused treatment center offered by the Center for Human Development. You're watching 22 News in Focus. Welcome back to 22 News in Focus. The Center for Human Development provides a broad range of behavioral health, substance use treatment, community support services, and mental health programs and services in Western Massachusetts and Connecticut. This year, they opened the Prospect Center in East Longmeadow, a facility offering mental health counseling in individual and group settings, peer support, medication, and early intervention services for children, young adults, and families. Joining me now are Nancy London, licensed clinical social worker and clinic manager of the Prospect Center, and Caitlin Prendergast, senior program director, Southern Region, CHD Outpatient Behavioral Health Services. Thank you both for being with us today.
Thanks for having us.
All right, so either one can start off the conversation or at least answer the question. And we'll get right into it. What did CHD decide to open this clinic?
So CHD had always had the plan to expand our services in the Pioneer Valley. So they wanted to make more of a footprint in the East Longmeadow and Longmeadow area. And simultaneously, as the need for our outpatient services has grown exponentially in the last few years, especially since the pandemic, all of our existing clinics have really grown in size. So with those factors combined, we are able to be where we are, just having opened the clinic only as of a couple weeks. And so we are very excited about that.
So how has it been going in the last few weeks?
It's been great. Busy.
Okay.
Busy and great.
Which is good to see, right?
Yes, absolutely.
Why focus on mental health intervention and counseling for children and teens?
So when I think of that, I think of why not? Why wouldn't we focus on that? It is so important, early intervention and treatment. So especially at the ages of childhood and adolescence where so much growth and development is happening. So if we can become involved soon, then we really need to. The sooner we become involved, then the more likely we are to either reduce or even resolve whatever it is that's going on.
You just opened this facility a couple weeks ago. What are your expectations as you move into the next coming weeks, months, and hopefully years?
Well, what we're doing now is we're reaching out into the community. We've already met with the high school. Next week, I was invited to the elementary schools. So we really want to hear what they want. How can we're new to the community, so we want to make sure we're meeting the needs of the community, of the families and the children that live there. So our goal is to make our center fun. That's the number one goal. And we want it to be welcoming. So we are really making ourselves out there, and hopefully we'll be able to put a huge footprint in the East Longmeadow and Longmeadow communities.
And when you go to these schools, who are you talking to? The teachers and staff, students?
So we've already started talking to the counselors, the school adjustment counselors in the high school. And then next week, we're going to do the same for the elementary schools.
Okay. Why does there seem to be an increase in mental health disorders in these age groups specifically?
Similar to what Bay State Health said earlier, I think we are very aligned in what we've been seeing. The overuse of social media can absolutely have a negative impact. It's undeniable to not mention the pandemic. That has absolutely had so much impact, even 4 years, post the start. So, and then one other thing that comes to mind, I think that the stigma has been reduced, which is wonderful. And with that, there's more awareness. People are talking about mental health resources more. So therefore, more people are seeking treatment. So we've seen a rise in those seeking help, and that is great.
Right, there are so many things going on in our environment right now. You mentioned the COVID-19 pandemic, which has passed us, but still we are seeing the effects.
Yeah, absolutely.
Social media being another major one. Election also just happened as well.
Absolutely.
So I mean, these, especially high school students now, they're paying attention to what's going on,
Yeah.
right? So I mean, that's affecting their mental health.
For sure.
What types of emotional and behavioral disorders are your clinicians seeing among younger clients?
They are anxiety, including social anxiety, selective mutism. We have seen depression, ADHD, OCD, autism, and
Those are most of what we have been
PTSD,
seeing. Yeah.
grief and loss. We've
more trauma.
Yeah, we've seen, unfortunately, a lot of significant loss lately with young people, whether it's family members, friends, pets. There's been a lot of loss lately, which is hard to see.
So when people do come into this facility, you mentioned that you want it to be fun, you want it to be bright and exciting. What types of things are you offering for kids and anybody who is dealing with mental health issues?
So right now, as I said before, we're kind of talking to the community. Our goal is to offer groups for all ages. We have on staff one of our clinicians who really focuses on art therapy, and it's amazing. It's absolutely amazing the work that he does and how the kids have just bought into that. In addition to that, we also, CHD has an early intervention program, so we've just started to offer community groups for the kids birth to 3. So it's a good opportunity, again, for us to be in the community and to really focus on children of all ages and their families.
How essential and important is it for the entire family to be involved when somebody is going through something like this?
Well, what we have been finding is you need to include the whole family. And sometimes the family isn't just the immediate parents. We're also talking about extended families, friends, the school, grandparents. Children come with a huge array of people who are there in their support system. And it's important that we tap into all of that because that's what the children need. It's a whole unit. And you can't just focus on one part of it. You got to look at it all together.
As we mentioned, of course, you just opened, but is there a goal in mind of how many people you want to help at a time? Obviously, you said you are very busy right now, but is there a goal out there?
Well, I think it's just to reach out to as many families, children that we can. Again, we want it to be fun. I want people to come into the center and just have a great time. We want to be loud. We want kids to have a great time coming in and parents really feeling supported. So we don't really have a number. It's an open door. Families can call us. We're getting them in pretty quick. And so, the center has many opportunities, not just with us, but throughout. I know Caitlin's going to mention that. So we're very excited about this whole opportunity for East Longmeadow.
And you are in East Longmeadow. You mentioned a little bit about why you're there, but is there a specific reason why you chose East Longmeadow?
We have other clinics in surrounding towns.
Okay.
That was just kind of an area that we just didn't have a lot of services being provided in. So it was a gap that we
Good
really wanted to fill.
central point right there, yeah.
Yep, absolutely.
Well, we do have some information for anybody who is interested on your screen right now for the Center for Human Development, a phone number 1-844-CHD-HELP, HELP. Also a website as well, chd.org. Anything else that is worth mentioning that you want to get out there to anybody who may be thinking about your services?
Sure. Just in addition to East Longmeadow, we also have outpatient clinics in Greenfield, Orange, East Hampton, Chicopee, Holyoke, Springfield, West Springfield, and of course East Longmeadow.
Okay. Well, thank you for being on today's
Thank you.
program. A lot of good information.
Thank you so much.
Thanks.
A coalition of mental health providers is focused on children and teens' mental wellness. We'll find out about these services, which are available right now when we come back. You're watching 22 News in Focus. Welcome back to 22 News in Focus. In 2019, the Springfield Youth Mental Health Coalition created an initiative that focuses on mental health resources for kids, caregivers, and adult supporters. There are multiple regional mental and behavioral health organizations that are part of this coalition. Joining me now are Tiffany Rufino, the Youth Mental Health Coalition Manager at the Public Health Institute of Western Massachusetts, which convenes the coalition, and Michelle Bakalian, Senior Vice President, Child and Family Community-Based Programs and Integration for the Behavioral Health Network. Thank you both for being with us.
Thank you for having us.
All right, so Tiffany, I'd like to start with you. What is the Springfield Youth Mental Health Coalition, and why was it created for this area?
Sure. The Springfield Youth Mental Health Coalition is a coalition of behavioral health professionals, private clinicians, youth-serving organizations, and other community-based organizations, Springfield Public Schools, a ton of others who we all come together and work on prevention methods for youth mental health. And the coalition was actually started as a result of the MGM Casino coming to the Springfield area and community wanting to know what one of the top health concerns would be with a casino coming to the area, and behavioral health, in particular youth mental health, rose to the top. So we are funded through the Department of Public Health Office of Problem Gambling Services.
How many organizations are part of this coalition?
Altogether, there are about 25 or so organizations that that participate in the coalition, and together we are able to work on 4 prevention methods, which is mental health awareness, which we have our morethanmymood.org website where there are tons of resources, professional development and community education, which BHN is one of our partners in that area, where the coalition is able to provide workshops and trainings to community members and folks working in behavioral health from that social and racial justice lens, and the coalition is able to fund those trainings, making them more accessible. And then we have our Beat the Odds youth advisors. They're a huge part of our coalition. And finally, we have a public health approach to problem gambling training that we will be facilitating in the community coming up next year, January.
You mentioned the reason for this is because of the MGM Casino opening up several years ago. How prevalent is gambling addiction among teenagers?
Well, gambling is incredibly socialized these days. We see it in all the things that we love to do, right? Like sports, whether we're playing or going to see sports, our mobile games, online games. You see tons of advertisements for gambling. And so I think that while it may not be a huge problem amongst teens right now, in a next year or so, especially with online gambling, it will become a huge problem, and we're seeing it grow as a public health concern and want to kind of get ahead of that.
Right, you don't just have to go to the casino to gamble. There are so many options out there for people to gamble right on your phone, especially.
Yes, absolutely.
Michelle, like adults, teens, and in some cases children use alcohol and drugs to self-medicate, leading to behavioral health problems. How does the coalition approach substance abuse in youth?
So there are several ways that you can do that. What we do when we're working with kids and families is we do an assessment and make sure that we understand where the child sits with their relationship to drugs and alcohol. So whether they're thinking about it, have been exposed to it, whether they've started dabbling in it, or whether they're deeper into something that looks more like addiction. So we do an assessment, we understand where the kid and the family are. And if they're starting to think about it, or if they're not in a place of addiction, we will help them work on what we call pro-social behaviors, things that they can do to, instead of the drugs and alcohol, healthy behaviors, things that will help them to manage the difficult feelings that they might be experiencing, find ways to engage in a healthy lifestyle that will last them through their lifetime.
And unfortunately, bullying has moved beyond the playground, and cyberbullying is on the rise, including among elementary school children. How can parents and school staff and communities help with this?
There's a lot that we can do here, and the first thing to do is to just talk about it, and again, it's education and prevention. So there's no doubt that social media has a place in our society today. What kids need to know and understand is that when they're communicating online, that there is someone on the other side of that communication. So it's talking to your kids about having empathy and making sure that when they're having conversations online, they know that a communication to them, it can be misinterpreted. You can't necessarily know what somebody's intent was, and then how to behave online, and then to limit their time online as well.
Absolutely.
Do you have anything else to add to that?
Yeah, and I would just say, you know, for parents and guardians to be curious about what their young people are viewing on their screens, right? Whether it's their computer screen or their mobile phones. I encourage parents and guardians to, like, if you're a parent or teen, like my daughter does sometimes, like to lock themselves in their rooms for hours, you know, go check on them, knock on the door, ask them what they're doing. Can I see, or what game are you playing? Because I think a lot of times we just want to let teens be teens and have their space, but oftentimes just speaking with them and having a conversation, you can really learn a lot. So I'd encourage folks to be curious.
Right, especially surrounding social media, parents should be involved, right? At least know what your kids are looking at, looking up, and doing.
Definitely.
Especially when your phone is so accessible, right?
Absolutely. And I just add with online gaming, you know, our kids are playing so many games online where there's these chat features. So it's not only the risk of cyberbullying, but also there's tons of predators on those on the screens, and playing games with them, and you know, being friendly, asking them what's their name, and then it gets into deeper questions. So again, just be curious and pay attention to what your young people are looking at.
For some, the bullying becomes too much, and children and teens take their own life, unfortunately. What can friends, family, and adults do to hopefully prevent this?
Yeah, so talking to your kids and being open, whether you're a parent, you're a teacher, whether you're a friend, oftentimes people think if I bring this thing up, then it's going to make somebody think about it. What it really does is start an open, transparent conversation. People are having these feelings. It's important to normalize them. It's important to say grown-ups have them, kids have them. Everybody's having, you know, everybody has challenging feelings, and there's a place that you can put that. It's also important, as our colleagues mentioned earlier, to kind of reduce the stigma that comes along with that. We don't talk a lot about what it's like to have big feelings, where to put them. When we normalize that, when we say that everybody experiences this, it kind of universalizes the experience, and then you can find different places to help them. There are, our colleagues actually mentioned earlier, community behavioral health centers where you can walk in or call and get an immediate appointment where they can talk to somebody right away. And they can talk to their school counselors, they can talk to pediatricians, but the first thing is really to make sure that you're having that conversation and not making it seem like it's a taboo topic.
Right.
Yeah, absolutely. And I would just add that, again, our morethanmymood.org website has tons of resources. They also have screeners. So if a young person or adult thinks that, you know, someone they know is struggling, they can go onto the website and just look at the different screeners that are available and see which kinds of things are coming up for them. And then also, you know, on the website we have crisis lines and text numbers and things of that nature. And I think crisis can sound like a really scary word, but on there we have what to expect. So folks actually click on that link quite often to see, like, what does it really mean when you call crisis, and what can you expect to receive as service.
And there is a website for the Public Health Institute of Western Massachusetts. Phone number there, 413-794-7739, and the website publichealthwm.org. Thank you both for being with us. Very insightful information.
Thank you. It's a pleasure.
All right, living in a rural area can make it difficult for youth to get mental health treatment. We'll have that discussion with what's known as Dial Safe, an organization that serves kids in need, after the break. You're watching 22 News in Focus. For children and youth living in more rural areas, finding and getting mental health services can be a struggle. Dial Self is an organization that has provided outreach, advocacy, and residential services to teens and youth since 1977. They have offices in Greenfield, Northampton, and in Orange. Joining me now is Samantha Pepe, a youth and young adult clinician with Dial Self. Thank you, Samantha, for being on our program.
Thanks for having me.
All right, so let's get right into it. First of all, what is the organization? Maybe some background on what Dial Self is and why it was founded.
Yes, so Dial Self works with young adults and youth under the age of 25 in Franklin County, Hampshire County, in the North Quadrant. It was founded in 1977 due to concerns about the lack of resources for at-risk youth in that community. And the mission of Dial Self is to help young people foster a sense of autonomy through housing stability, education, employment, and civic engagement opportunities.
Many services are seeing an increase in mental health patients. Are you seeing that as well?
We are. We're seeing a consistent need for mental and behavioral health for the youth that we work with. Many of the youth that we work with have experienced different levels of trauma, housing instability, substance use and abuse, abuse and neglect, exploitation, all has contributed to the need for behavioral services.
Now, while Dial Self focuses on teens and young adults, some of them may have had mental health and behavioral issues as children that were not recognized or addressed. What can be done to bring attention to the importance of early treatment?
Yeah, so early detection and prevention is key into mental health outcomes. I think it's important for parents and guardians and caring adults to recognize the needs of the young people they're around, to take their needs seriously, to check in, like many of the other people on the show have expressed. In addition, I think if there are people in positions, not even in the mental health field, but positions of working with kids and youth, they should have some basic knowledge of mental health illnesses so they can help detect issues as they arise. And continuing for the mental health agencies in the community to keep those wait lists really low so that if a young person does want services, it's access right away.
What are some of the issues that are unique to your region when it comes to mental health care for young people? Obviously, homelessness being one of them, low-paying jobs, hunger, transportation. I mean, the list goes on and on.
Yeah, so it is a rural community, so transportation access to services can be difficult. As well as continued stigma, like was mentioned before. All of these traumatic issues that you have expressed impact outcomes later in life. So we know from the ACEs study, it's the Adverse Childhood Experience Study, that trauma in early childhood impacts mental and physical outcomes later in life. And so we know that trauma also impacts brain development and brain functioning. Which increases stress and anxiety and depression, and also impacts impulse control, which can be very dangerous for young people.
Well, speaking of impulse control, eating properly obviously can help with your mental health and basic needs. What else can help get your mental health maybe back on track?
Yeah, overall well-being is important. I do think young people often do not focus on their physical health. We push that back. Young people are very healthy, and so, case managers are trying to get them to think about dental work, PCPs, all like a holistic approach. And nutrition is incredibly important. Food access is important. So our youth workers can help them apply for SNAP. They can use our food pantry, access community meals.
Oral hygiene, is so important as well, because your mouth, depending on what's going on in it, can really affect your entire body.
Absolutely.
So it's important to obviously pay attention to that, what you're eating, working out, things like that. What types of behavioral and mental health programs and services do you offer?
Yeah, so we are mainly focused on housing stability, education, and employment resources, but our youth workers work with young adults to assess mental health needs and make appropriate referrals depending on the level of need. We recognized during COVID high wait times for people to access that. So in-house we do a bridge therapy program, so it's short-term focused program to literally bridge the gap for the needed services. We also can work with families if there is conflict in the family that's causing instability. The hope is to reunify young people as long as the home is safe. So we use cognitive behavioral therapy approaches, dialectical behavioral skills, and solution-focused methods.
How does someone apply for your services, and what is the process like?
So we have physical locations in Greenfield, Orange, and Northampton. We have a drop-in on Monday and Wednesdays in Greenfield, and by appointment in Northampton and Orange. They can come into the space, or they can give us a call at 413-774-7054 extension 4 to schedule an intake. A youth worker will go through an intake and then assess what the need is and go from there.
Is there a certain amount of time that people can use your services?
Nope, it's just for under the age of 25.
Okay. Why that age? Any specific reason?
Just contracts
Okay,
and
okay.
funding sources.
Okay.
Yeah.
How does, we talked about applying, you mentioned the locations as well. The 3 locations here, I believe they were all in Franklin County?
In Hampshire County,
And
Northampton.
Hampshire, you're right.
Yep.
Anything else?
In North Quabbin.
Okay,
Yep.
okay. What types of housing do you offer for your people who are seeking help?
So we have a multitude of apartments in those communities we spoke about, and all of them have a case management supportive program. We also have financial assistance young people can apply for if they're in a hardship, and to help stabilize them within the community. Dial Self can also work with young people to apply for non-Dial Self housing. We also run a 24-hour emergency shelter for youth under the age of 18, and a 24-hour hotline for youth between the ages of 18 and 24 to help them troubleshoot the immediate need of safety for that night and then connect to longer-term services.
Are there ways for others to support your work?
Just like continuing to learn about youth needs, learning about the LGBTQ communities, the BIPOC communities that do have higher levels of vulnerability due to discrimination. You can check out our website for more information at dialself.org. You
also have a phone number as well, along with the website, 414, we can get that on the screen right now, 414-774-7054, and the website as well as dialsafe.org. Samantha, anything else that is worth mentioning for someone watching who may be curious about the programs and services that you offer?
Nope, I think that we continue to try to support the community in the best ways we can. We're flexible as we need to be. It's not one size fits all for all the youth, so it depends on their need.
We, of course, as you mentioned, have seen an increase in these mental health issues among kids and really everyone. Do you see the mental health stigma ever going away? Obviously, we're working on it year by year, but are there ways to maybe get rid of the stigma as a whole?
I am encouraged by young people's openness to talk about their mental health and their mental health needs. I do think that for the youth that we work with, it seems to be more accepted to be able to express your needs and to access services. So I'm encouraged by the path that I see the young people taking in speaking about this.
Okay, Samantha, thank you very much.
Thank you.
All right, we'll have some more information when we come back. You're watching 22 News in Focus. You've been watching 22 News in Focus. On today's program, we've been discussing some of the many mental health and substance abuse treatment options for children and teens in the Pioneer Valley. Thank you to all our guests for being on today's program. And if you missed any of it, you can find it on our website at wwlp.com, as well as the links to the organizations represented on today's program. From all of us here at 22 News, have a great rest of your Sunday.